The squat is an excellent way to assess the overall health of your lower body, because when something is tight or weak, we will see obvious compensations with that movement. Now, because the squat translates so well into many other normal everyday movements, identifying and addressing these compensations now is pivotal in making sure that we don't have unnecessary joint damage long term. Starting at the foot and ankle, if when you squat, your heels cannot stay on the ground, if you go all the way down, you likely have tightness in what's called ankle dorsiflexion, which is this angle right here. Now, one compensation that people use to get around that is they'll squat with their feet turned out a little bit, and then they'll move into what's called pronation at the foot. Now, what this position does is it flattens out the arch, meaning the foot is now less stable, and it also pulls the knees in together. Now, moving up the leg, another reason why people's knees will tend to move together like that is because their hip abductors are weak, mainly the gluteus medius muscle. Another thing we'll see when we have a weak glute is that when someone squats, they'll shift towards the stronger side, away from the weaker side, because in this position, the stronger leg is carrying more of your body weight through that motion. The other reason why we'll see a lateral shift, either left or right, is because the hip is limited in internal rotation mobility, which is like this. As we go all the way down in a squat, if you lack this motion, you will have to shift away from the side that's tight because you run out of mobility in that joint. Going along with that same mobility deficit, if when you squat, you get a lot of pain in the front of your hips, it's not likely the hip flexor that's the culprit. It's either a restriction in that internal rotation, if you use a more narrow squat, or you might have tight external rotation if you have a more wide squat stance. Now, moving along to the low back, if you see someone squatting and they have to bend really far forward like this, bending at the low back, this is because either the ankle's tight, meaning that my knees can't move far forward so I can maintain a more upright posture, or my hip is tight and I'm bottoming out right there. In order to get more motion, people will bend the back instead. Sometimes we'll see people move the opposite way, meaning they will extend the low back when they squat, trying to keep that chest as far up as possible and pushing the hips back. Now, this is likely because they're not bracing the core, or they just have weakness in the core and they're relying more on the muscles along the low back to help move that weight. As you can see, there are many different things that could be going on with your squat, all of them causing some sort of compensation. Now, if you can figure out specifically what's going wrong and then address that now, long term, your outlook is going to be much better than someone who doesn't address these sorts of things, because it's compensations like these over the course of a lifetime that results in breaking down of the back, the hips, the knees, and the ankles and feet, eventually leading to things like joint replacements. If you found this video helpful, I would appreciate if you could hit that like button so other people can find it as well. Otherwise, if you want to learn how to fix most of these things, you can watch this video here.